Hi guys, my name is Dr. Michael Doe. I'm a general pediatrician. With DMG, but here at Valleywise Health, and I am the director of our Valleywise Pediatric Refugee Clinic. That's my main gig, but I'm also a part-time hospitalist working on the newborn nursery and the pediatric wards, and I also do clinic 1 day a week at the South Phoenix Levine Family Health Center. But the refugee clinic is a huge part of my passion and the reason I'm here with Valleywise. And I'm really proud of the work that we've been able to accomplish as a clinic. The Pediatric Refugee Clinic, it works as, I guess what we strive to be a primary medical home for refugee and immigrant children, and also children born in the United States to refugee and immigrant parents. And given the medical and social complexities that these patients face, I think they require a little bit extra attention and a different perspective at times, hence the need for our pediatric refugee clinic. So I'm really proud to work alongside the team we got to care for the patients that we do. I was born in the United States, specifically in Texas, to Vietnamese refugee parents. My folks immigrated to the United States as refugees in 1975 to flee the Vietnam War. They ended up separately, but coming together in Dallas, Texas, high school sweethearts, and then that's how I came around. I grew up in Texas, went to college and medical school there, and I came out to Phoenix to do residency in pediatric residency training. But, for a while, I've always had interest in global health, if you may, working abroad to care for perhaps the most underserved patient populations around. And so during my medical school years, I had the ability to participate in our global health track, which gave me some additional education for things that are relevant for those that are considering careers abroad, but also afforded me the opportunity to go abroad a few times and experience different clinical and educational experiences. When it came time to choosing a pediatric residency program, well, I guess I should wind it back first and tell you how I ended up choosing pediatrics. Because old people are gross, man, and you get to be more fun, you get to be more goofy with kids, and that's what I like. That's what I love, and we get to do that every day, day in and day out. I like pediatrics for that reason, but also because you still get to see a breadth of patients. We see newborns all the way to 18-year-olds, and that itself is a tremendous amount of variety, right? But still allows you enough time to dive deep into all the issues that are relevant to child health. So I really like the idea of being a primary care provider and having the ability to see patients throughout the continuity of their growth and development. So that's what spoke to me about pediatrics. I also really enjoy that pediatrics involves a lot of education, both for the child and for the parents. And for me to be able to have a potential impact, again, on those two different levels, I think was a big sell for me for pediatrics. So that was, I like all medical students do, they go through that journey and figure out what specialty they want to do. And that was mine when I was wrapping up medical school in Texas, all while completing my global health program, if you may. And so when it came time to choose a pediatric residency training program, I knew it would be challenging to find opportunities to travel abroad and experience medicine in those international settings during a hectic residency program. And so I wanted to go to a place where I would be able to still learn from populations and learn lessons that would be translatable to an international environment if I did choose to pursue that in my career. And so that's how I ended up in Phoenix. And I did my pediatric residency program with the combined Phoenix Children's Hospital and then known Maricopa Integrated Health System program. And I did those 3 years of pediatric residency training here. I wanted to do that because I knew I would have the opportunity to work with the larger underserved population here, which includes our Hispanic population as well as our diverse refugee communities. And I knew getting a chance to learn from this special population at MIHS, now Valleywise, that it would give me great training if I did indeed decide to go abroad and work in those international settings like I dreamed of. So that's kind of how I ended up in Phoenix. And during residency, if you may, I took a lot of opportunities to learn more about our local refugee communities by going to different community events. Um, Pre-pandemic, that was a thing, and learning more from different folks. I sought different learning experiences as a pediatric resident, so I did extra clinical experiences with the Maricopa County Department of Public Health Refugee Screening Clinic, their tuberculosis clinic. As I kind of kept doing that, my interest in refugee immigrant health continued to grow. And it's very similar to that of global or international health. It's kind of a way to do that locally, if you may. Um, and ultimately, the folks here at MIHS asked me to stay on to lead our pediatric refugee clinic once I had graduated from our residency. And I was tremendously proud to be considered for that. And I'm happy to have accepted that position and done so for the past almost 5 years now. It's been great. I like it. We do a lot of good work. And if you're asking me about my background and my decisions to do it, it definitely came from my interest in global and international health. But I would definitely say that there's definitely been an influence with just kind of my parents' own immigration story. I know they busted their butt to get to where they are now and to provide for me and my siblings. But I also know that they didn't do that without some assistance. And so if now I can provide similar assistance to other refugee families, I think it's pretty cool. I think that's pretty cool to kind of hopefully help folks along, like my parents were helped, and hopefully that will make for better, stronger, healthier families. So I think that's really powerful as well. I've had the fortune of being able to travel to a number of places, and I'm very thankful for those experiences. During medical school, I did electives in Peru and in Uganda. In Peru, it was a field epidemiology course. So think like how to work up outbreaks and epidemics before those were cool. You know what I mean? Even before the big Ebola stuff and before this whole COVID shenanigans. And so it was cool to play and walk around in spacesuits and figure out how you would proceed to manage an epidemic, if you may. Um, but the course I did in Uganda, I would say is probably one of the most impactful experiences I've had thus far in terms of my education, training, and subsequent career. It was a course in northern Uganda, and I think the title of the course gives a lot of insight into what it covers. And it was beyond the biological basis of disease, the social and economic determinants of health. And so it was a course about social medicine, not socialized medicine, but social medicine, and how you kind of approach a patient and an individual, not on that individual level, but thinking broadly within the context of their history, their community, economic, financial, cultural considerations, and how those all impact a person's health status, their ability to access healthcare, and the quality of care that they receive. It was really powerful to be able to learn about those topics within the setting of northern Uganda, where there has been so much civil strife and conflict over the years. So that was super impactful for me, and in my decision to want to work with underserved populations to have some of these more global health aspirations. So I owe a lot to our course instructors, the various educational experiences we had, and the peers that I learned alongside with, which included Ugandan medical and nursing students as well. So it was a really cool experience. That's kind of those are the couple of the bigger international experiences I've had. And during residency, I had the opportunity to spend a month on the Navajo Nation, which itself is its own sovereign nation. And it was also a very interesting and informative experience as well. In many ways, that's another way that physicians can partake in global health, but more locally without leaving the confines of the continental United States. Because on the Navajo reservation, as this pandemic has shown, they are lacking for a lot of resources, and that definitely impacts their health status. You're also working with patients and families that come from different cultures and different life circumstances, which are all things that you're invariably going to encounter if you do end up working abroad. And so that was also a very useful experience that again, if we'll see where my career goes moving forward, but I know that those lessons learned there would translate well to other environments as well. There's plenty of those stories, and it's really cool to see. Our refugees, by definition, have a tough go at it, right? They have been forcibly displaced from their country, from whatever war, civil conflict, famine, natural disaster, whatever. They're in this whole limbo zone as they just travel around trying to seek safety and asylum. And then once they land and are resettled in the United States, that's not the end of it. They still have to adjust to a brand new culture, society, language, et cetera, et cetera. And so when our refugees are newly arrived here in the United States, it's almost overwhelming, all of the needs they have. And for us to be able to assist with those families, even beyond the traditional roles of a pediatrician, I think that's really cool. In one family in particular, I remember they came to the United States in 2016. They are Congolese, so from the Democratic Republic of Congo, but they lived in a Tanzanian refugee camp for 20 years before coming to us, So think about the circumstances, that would be there. What is their access to reliable food sources, to quality health care, preventative healthcare services? And then here they're thrust into this new world where they have limited context, right? And so not only that, I think at the time it was mom, dad, and 8 or 9 kids, and so it was a large family, and it felt like each child had their own health issue that we were trying to deal with, all couched within this kind of larger conversation about our health system and life and society here in America. So it was challenging to work with this family with so many children, with so many different medical things to juggle. But I am super proud of them because they stuck with it, and they were able to learn and to adapt, and ultimately the kids are all doing great. And now I think it's actually a family of 11 children with mom and dad. And so to see all of them, to see the kids born in the United States and see them grow up too, that's been really cool. That's been really cool. And I know the parents are really happy to have been able to come to our clinic, and I'm tickled that we were able to help out like we could. So that's definitely one thing, that one story that sticks out to mind. I'm really every time I see their name on my schedule, it's like, oh yeah, we can catch up for a little bit. It's good. I like it. I think some of the other stories in which really stand out to me are when we are dealing with children with complex medical needs, because many times in the environments that they came from, for a variety of reasons, be it a lack of existing healthcare services, language barriers, financial status, a lot of these children haven't had all the medical care that they needed due to their medical conditions, you know what I mean? And I ended up seeing a young boy from Afghanistan early in 2020, and the family lived in Afghanistan and then Turkey for a bit. And in Turkey, they noticed that the boy was sick, and he was in the hospital for a bit, and his mother didn't really know what was going on. But once, he came to the United States and we kind of tucked him in our clinic, we were able to kind of learn more about the child, learn more about his family, get him into the right care, and really help diagnose the really rare genetic condition he had. Thankfully, it's not a super serious one, and one that I'm really worried for the kid. I mean, he's going to need ongoing subspecialty care, that kind of thing. But I just know that the mom was so relieved to have an answer, to have someone that would be able to help them through this journey and kind of explain things in a fashion that they can understand more easily. And, that's something I'm also really proud of, and especially, when mom shows her gratitude and is thankful for our assistance, that's really cool. I like that. There's no single refugee story, right? It's going to be because they're from all different parts of the world. There are going to be all different languages, cultures, health conditions, and it's a lot to juggle on top of just regular child health, right? And so one of the ways we try and address some of the challenges in working along with our refugee families is with the assistance of our cultural health navigators. And that's a staff member we have at our Valleywise Refugee Clinics, the pediatrics, obstetrics, gynecology, and internal medicine. And these cultural health navigators are absolutely essential to what we do. We call them cultural health navigators because they really do help navigate our families through the healthcare system. They'll remind our families of appointments, help arrange for transportation through their health plan benefit, assist them with checking in at the registration desk, assist their medical assistant as they take their vital signs, interpret for us providers during the medical visits, help our medical assistants as they prepare them to discharge them. At times, we'll accompany them downstairs to show them where our lab is, where the children do their blood work. At times, we'll follow up with them after the fact so they can review with the family about the different medications that I prescribe so that they understand how to give it to the kids appropriately. Or even at times following up on the referrals to subspecialists that I make. So again, they really are with our families every step of their journey as they interact with our healthcare system. And our cultural health navigators serve as that link between our respective refugee and immigrant communities and our healthcare system. They are tremendously invaluable and irreplaceable and absolutely essential to the work we do. In our Pediatric Refugee Clinic, we have cultural health navigators that collectively speak 11 different languages. And that covers a large swath of refugee communities here in Phoenix, which allows us to provide that care to this more special population, right? And so I am tremendously thankful for their involvement in our Valleywise Health refugee programs, because again, it would not be possible without their hard work. The COVID-19 pandemic has shown all the different health disparities that exist amongst our disadvantaged populations. Those that are struggling for a variety of reasons were hit the hardest by our pandemic, right? And that was definitely the case with our refugee populations locally. You know, amongst the different refugee service providers here at Valleywise, we were noticing more COVID cases in our refugee populations in March and April. And we kind of had a mini peak of sorts before the general peak in July and August of 2020. We knew that they were going to be more impacted by the pandemic. Here you have a population that, with the language, the transportation barriers, how are they accessing healthcare? How are they accessing health education materials to explain what COVID is? How do you translate social distancing into a way that's going to be understandable for our families, right? And shoot, how do you even distance if you live in a home with 12 people, like I was just telling you, like multi-generational homes that are going to be more common in our immigrant families? Not only that, many of our refugee families, they were frontline workers that didn't have the opportunity to work remotely, whether they're in the hospitality, janitorial services, food service industries. They were going to be the ones with the most exposure to COVID in the community as well. And so for a lot of those reasons, that's why I feel like they felt the brunt of the pandemic a little harder, a little earlier than a lot of our other folks. And again, not to discredit the impact it's had on everyone else and our other underserved populations here in Phoenix as well. But as we talked about it as our Valleywise refugee service team, again, pediatrics, obstetric gynecology, internal medicine, we started to realize that there was a need for education in a fashion and way that our refugee families would be able to understand and accept. And so we spoke some with the Arizona Refugee Resettlement Program, and in particular, our state refugee health coordinator. And we kind of brainstormed and thought a video series would be a good way to put out that health education material. Because in video, you don't have to worry if families are literate, or because many of our families have varying levels of literacy even in their native languages. So a printed handout that's been translated with a bunch of bullet points may have varying levels of impact depending on, again, the literacy that they have in their respective languages. So having a video format would allow you to hear the spoken word and more readily understand the message. We also wanted to do videos because that would give us an opportunity to showcase our cultural health navigators. Like I mentioned earlier, they're our link between the respective refugee and immigrant communities and our healthcare system. They are trusted members in the community, right? They are members that have worked with our refugee families for years on end. And so to have them be highlighted in the video, so that our communities can see a trusted figure speaking their language, speaking health education material that they haven't had access to previously, we thought would be a great way to do that health education about the COVID-19 pandemic. I'm really proud of our crew. These conversations started, I think, in late March. And in a whirlwind of days, we were drafting scripts, thinking about what are the most relevant points to include for our refugee families, getting those scripts translated into 10 different languages, convincing our cultural health navigators that they do want to be filmed, and then filming their monologues and little cutaway scenes. It was kind of interesting to play in the pretend movie business for a bit, not your typical pediatrician gig, right? But doing all of that from start to finish, like brainstorming to posting on YouTube, I think it was 10 days. And so I am tremendously proud of our collaboration between the Arizona Refugee Resettlement Program, the Valleywise marketing and media crew, and of course our cultural health navigators, and amongst the different refugee clinics here at Valleywise, to all come together and to put out that video series so quickly. And I think it ultimately is because everyone realized the importance of it, right? Now you should also shout out our videographer, Grace Clark, that was the one filming and editing those videos as well. So it was a big collaborative effort with Grace, Juliana, our state refugee health coordinator, and all of our staff members here at Valleywise to make those videos. So that was kind of the motivation, if you may, on how or why we wanted to do that. The first video series talked about what is COVID, how do you prevent it, aka social distancing, hand washing, et cetera, et cetera. And then we also made a second video series to talk about what should you do when you're sick? Because again, how does the word self-isolation translate into Kinyarwanda? What does that actually mean to our families? What is quarantining? Why do you tell me I gotta be all up in my room by myself? That kind of stuff, right? And so we wanted to have another way to clearly communicate to our families what they should do in the case that they were sick. And we are now wrapping up editing and production of our third video series, which centers around the COVID-19 vaccine. Hey, why is it safe? Why you should get it, et cetera, et cetera. And so it's been a lot of work, but I'm super proud of our crew for doing that, because I know it's having an impact. Different families have come and told us, thank you so much. I hadn't heard this before. No one told me this in my language. I didn't know. Now I know what I can do to keep myself and my kids safe, and that's cool, right? That was our goal. That's what we wanted to do. The item on our wish list when I speak with my colleagues in the Refugee Women's Clinic and Refugee Internal Medicine Clinic, we would love to have in our perfect world, a standalone clinic where we could house the three service lines and become more unified, work more together, underneath the same administration management, share the same cultural navigators that are critical to the work that we do, and really just kind of amplify the impact that we're able to have. That's our dream, to have this standalone singular clinic dedicated to these more unique and special populations. I could keep going. In this perfect standalone clinic, we would love to have a mobile health unit, so you could go to the refugee populations, right? And you don't have to deal with the transportation barrier that exists. How is a family going to navigate our public transportation system from Glendale to come to our clinic here in Central Phoenix? You know what I mean? If they don't know the language, they don't understand the culture of the system, right? How are they going to be able to get here if The breadwinner of the family is taking the car for work, and now we got 10 kids. You tell me that I got to take for checkups every month. What's going on? So transportation is a very real barrier to our families, as they are for other families as well. And I think to have more of a mobile clinic setup where you could go to them would be really tremendous as well. I'm a pediatrician. My gig is hanging out in the clinic or in the hospital talking with kids and their parents. That's what I'm most comfortable, what I'm most used to. But I think given the more unique needs of these populations, require more unique solutions. And I think one of those would be kind of more community outreach and like getting outside of our clinic, getting outside our hospital, meeting our families and communities in the environments that their environments there that they're used to, instead of this foreign, new, possibly intimidating clinic setting, right? Getting in those environments and really doing more outreach to explain various health education materials. She would even make like a health literacy curriculum to kind of explain to them things that oftentimes we assume our families understand, like how to make an appointment, how to get there, what should you take to your appointment, your vaccine records, your records from other hospitals, hey, what are you supposed to do with this prescription that your doctor gave you? She didn't give you a piece of paper. Where do I go? What do I show them? And what is this refill thing you tell me about? I just go, I don't have anything with me, and they give me more medicine. These are a lot of things that us as providers, we may assume about our families if we don't ask or learn. But many times in our refugee families, if you do ask or take the time to ask, talk to them about it, no one's really properly explained it to them, much less again in a language and fashion that is readily understandable, right? So there's a huge need for this community education and outreach and discussion on health literacy. If you've never been to a clinic before and you got a more intimidating like doctor figure, depending on what your previous healthcare experiences were, perhaps you're not going to be super forthright, perhaps, or you just want to be super respectful and deferential and just kind of go with things instead of voicing your own concerns. And so you are very correct. The different cultures requires us to take a different approach when we're speaking to our families. And again, I think that's why doing community outreach, getting into those environments in which they're more comfortable, would be a great way to engage in some of those conversations. I'm going to make a plug for one last wish list item. There is a family medicine physician out in Denver, and he's done something that I'm tremendously jealous of. He has started a Boy Scout troop for refugee kids that he sees in his clinic. And as a Boy Scout and former Eagle Scout and everything, I would love to do that. That would be so cool. Could you imagine taking this ragtag group of folks from all around the world going for a first camping trip in the desert or something? God, that would be wild. I think that would be so cool. I think that would be a nightmare to organize and supervise, but I just think it would be a tremendous experience. I owe a lot of my upbringing to my experiences I got during scouting. I think to share it with such a multicultural and diverse group, that would be super cool. Greater collaborations with dental clinics, greater collaborations with mental health facilities, given the needs of our patients, more integration of video education materials, translated patient education handouts. I'm always in the search of more children's books in the languages of our families. I'm a big fan of that, and kind of empowering our families to know that they have a role in their child's development. They have huge capacity as their child's best teacher to read, to engage and teach with them. And giving our family books that are in the languages of our families, I think, is a fantastic way to show them that this is possible and this is something they should do, that they want to do with their kids. And so I'm always in search of books from different vendors that can cater to our different refugee and immigrant populations. I am super grateful for anyone who's willing to donate to the work that we are able to do. I've repeated myself a bunch of times, but I'm really proud of what we are able to accomplish. I say we as our team, our physicians, our nurses, and then certainly our cultural health navigators, our care coordinators, our social workers. I'm really proud of what we're able to accomplish. And any support in those efforts, again, is only going to amplify our impact and be able to reach these hard to reach populations and then deliver them quality care that they can access, that is understandable to them, that is really challenging to get elsewhere without the support that our clinic and our staff provides. So any donors working with our clinic and or the Valleywise Health Foundation, I'm tremendously grateful for that, because any such donations have a direct correlation to our ability to better provide care for these families, to provide more comprehensive and relevant care, especially given their special medical and social needs. Again, I'm super proud of what we do, and I'm happy to collaborate with other folks as we continue to improve and expand our pediatric refugee clinic services.